Number 10. The cranial drill of nightmares. Picture this. You've got a headache. Not an aspirin-type headache, but a my skull feels like it's about to implode kind of headache. In the ancient world, there was no Tylenol. There was, however, a cheerful little practice called trepanation, which is just a fancy way of saying, let's drill a hole in your skull and see what happens. Yes, people in ancient civilizations actually believed that evil spirits, demons, or bad air were trapped in your head. The solution? Carve an exit door straight into your skull with a sharp stone or bronze drill. Archaeologists have found skulls from as far back as 7,000 years ago with these perfectly round holes. And here's the creepy part. A lot of them show bone regrowth, meaning the patient survived. You walked around with a literal peephole in your head like a medieval fish tank and somehow kept living. From Peru to Egypt to Greece, trepanation was basically the go-to brain fix. Got seizures? Drill a hole. Got migraines? Drill a hole. Got bored on a Tuesday? Guess what? Drill a hole. Imagine your neighborhood barber doubling as your neurosurgeon, casually scraping through your skull with a rock while humming a little tune. And if you're thinking, well, maybe it worked? Yeah, sometimes it did. Relieving pressure inside the skull can ease swelling, but most of the time, it was like opening a soda can with a hacksaw. Messy, horrifying, and wildly unnecessary. Basically, ancient doctors invented neurosurgery before anesthesia and sterilization. You didn't get a hospital gown, you got an infection. Number 9. The bronze catheters of Egypt. Okay, let's head to ancient Egypt, where pharaohs had gold pyramids and metal sticks shoved where the sun doesn't shine. Yes, I'm talking about catheters, but not the sleek silicone ones we have today. Nope, bronze catheters. Imagine a stiff metal straw designed to relieve urinary retention. Translation: if you couldn't pee, someone shoved a literal bronze pipe up your urethra. If your body cringed reading that, good, because it gets worse. The insertion process was about as fun as sliding a rusty nail into a paper straw. No lubrication, no numbing gel, no gentle hospital nurse, just some dude with steady hands, hopefully, and zero sympathy. And if you were really unlucky, they sometimes used reeds instead, because apparently nature's catheter was also a thing. The Egyptians were advanced in so many ways, but let's be honest, this was less medical progress and more state-sanctioned torture. Infections were inevitable, pain was guaranteed, but at least you weren't dead from a burst bladder, yet. So the next time your doctor prescribes cranberry juice for a UTI, remember, it could be worse. You could be living in 1500 BCE, staring down a guy with a bronze tube and a confident smile. Archaeologists uncovered a Roman vaginal speculum in Pompeii, and honestly, it looks more like a medieval torture device than a medical tool. Imagine a metal claw that opens like a camera tripod. Instead of holding a camera, it's holding, well, you. This wasn't some delicate ergonomic plastic thing from your gynecologist's office. Nope. This beast was forged from iron, with screws that pried the device open wider and wider. Roman doctors used it for diagnostic purposes, which is ancient Latin for, we don't know what's going on in there, but let's crank this open until we find something. It probably clanged, squeaked, and pinched like rusty gates to hell. Oh, and let's not forget, they didn't have disinfectant. That same speculum probably saw a dozen patients in a single day, still carrying yesterday's mystery germs. So while modern gynecology isn't exactly anyone's spa day, at least you don't have to deal with a Roman blacksmith moonlighting as your OBGYN. The Pompeii speculum proves one thing. Sometimes ancient innovation is just code for metal contraption guaranteed to traumatize you forever. Number 7. The bladder stone crusher. Imagine you're in ancient India and you've got bladder stones, big painful ones. Today you'd go under anesthesia, get a laser zap, and be home by dinner. Back then, they had a tool literally called a lithotrite, which translates roughly to stone smasher. Because nothing says healing like crushing rocks inside your bladder with a pair of medieval nutcrackers. Here's how it worked. The surgeon would insert a long metal rod into your urinary tract. Yes, again with the urethra. History really had it out for that poor organ. Once inside, they'd maneuver the device to grip the stone, then twist, grind, or break it apart. Congratulations, your bladder is now a rock tumbler. If you're lucky, you pass the fragments naturally. If not, they might go in again for round 2. And remember, no antibiotics. If infection set in, you were basically toast. But credit where it's due. This was a step up from the even earlier method of cutting straight into your bladder with a knife. That was basically surgery by Fruit Ninja. The stone crusher, while horrifying, at least kept everything internal. Small victories, right? Number 6, the hemorrhoid branding iron. Ah yes, hemorrhoids. Humanity's least glamorous medical complaint. In ancient Greece and Rome, the cure wasn't creams or donuts to sit on. Nope, they used the hemorrhoid cautery iron, basically a branding iron designed for your butt. Doctors would heat a metal rod until it glowed red, then apply it directly to the swollen veins. The idea was to seal them off. The reality? You got seared like a steak. Picture lying there, pants off, while your physician roasts your hemorrhoids like marshmallows at a campfire. Even Hippocrates himself, the father of medicine, recommended this delightful method. Because nothing says healthcare like screaming into the void while your rear end is on fire. To be fair, cauterization can stop bleeding, so the Greeks weren't totally wrong. But they were also inventing a new form of psychological trauma. Congratulations. Your backside is now both flame-broiled and forever suspicious of candles. Number 5, the tooth extraction pliers of doom. Let's move to dentistry, where ancient tools looked more like medieval blacksmith gear than anything you'd see in a dentist's office. The go-to instrument? Giant tooth extraction forceps. Think pliers, big, metal, clunky pliers. Got a cavity? Out it comes. Got an infection? Yank it. Did your barber surgeon just feel like practicing? Guess what? You're going home with one less molar. No anesthesia, no numbing injections, just a chair, a strong grip, and maybe a shot of wine if your barber was feeling generous. Teeth were often pulled out whole, roots and all, with a noise that probably sounded like someone tearing open a wooden drawer. Archaeologists have found entire sets of these terrifying dental kits. Forceps, levers, even hooks designed to wiggle teeth loose before the big pull. Basically, you'd sit down expecting dental care and leave looking like you'd been mugged by a toolbox. Modern dentistry may give you a bill that makes you cry, but at least it doesn't involve your dentist asking, "Hey, do you prefer the rusty pliers or the slightly rustier pliers?" Number 4, the ancient amputation saw. Let's say you got an infected limb in the ancient world. The solution? Cut it off. Quick, brutal, and hopefully before the rot spread. Enter the amputation saw, a tool that looked exactly like a carpenter's saw because, yeah, sometimes it was a carpenter's saw. Surgeons would tie you down, maybe give you some alcohol or a piece of leather to bite, and then just saw away. No anesthesia, no sterile environment, just raw human determination and a crowd of onlookers hoping you didn't bleed out before lunchtime. The speed of the doctor mattered a lot. A good surgeon could lop off a limb in under 2 minutes. A bad one? Let's just say your operation might feel like a live woodworking demo. Blood loss was a constant threat, and infection afterward was practically guaranteed. But hey, you'd rather be alive with one leg than dead with two, right? Ancient medicine was all about compromise. Fun fact, some ancient amputation saws even had ornate carvings, which means someone thought, yes, let's make this bone-slicing nightmare decorative, because nothing says comfort like floral patterns on the thing about to detach your leg. Number 3, the smoke enema. Ah yes, the tobacco smoke enema. Picture a long tube-like device, a bellows, and a doctor with way too much confidence. This delightful invention was used in ancient and early modern medicine to revive people who had drowned. The theory? Blowing smoke, literally, into the rectum would stimulate breathing and circulation. Yes, if you passed out, some guy's emergency plan was to shove a tube up your rear and pump tobacco smoke inside you like a human hookah. This wasn't rare either. In fact, smoke enema kits were once so common that they were kept along riverbanks for quick access, kind of like how defibrillators are today. Except, less effective and infinitely more humiliating. Patients rarely revived. Instead, they just got smoked like brisket from the inside out. Eventually, doctors realized tobacco smoke wasn't magic CPR, but not before traumatizing a few centuries' worth of near-drowning victims. So yes, the phrase blowing smoke up your ass isn't just a sarcastic saying. It was an actual medical procedure. Ancient science, where desperate ideas went to die. Number 2, the bloodletting lancets. If you lived in ancient Greece, Rome, or medieval Europe and got sick, your doctor probably didn't prescribe rest and fluids. Nope. They brought out the bloodletting lancet, a razor-sharp blade designed to slice your veins open so you could release the bad humors. The theory was simple. If you're sick, your blood is bad. Solution? Drain some out. In practice, you just got very dizzy, very pale, and sometimes very dead. Physicians swore by it, using lancets to treat everything from fevers to headaches to the plague. Spoiler, it didn't work. Some lancets were beautifully crafted with polished brass and folding blades, because if you're going to bleed someone to death, at least make it classy. Barbers also performed bloodletting, which is why the barber pole is red and white. Yes, that candy cane pole outside Supercuts is actually a monument to centuries of unnecessary stabbing. So next time you're sick and someone says, "Get plenty of fluids," be thankful those fluids don't include half your bloodstream in a wooden bucket. And finally, we arrive at one of the creepiest medical devices of all, except this time, the device was a dead body. Starting in ancient Egypt, but really peaking in medieval Europe, doctors prescribed mummy powder as medicine. Yes, people ground up actual mummified corpses and swallowed the dust, believing it could cure headaches, ulcers, and even the plague. Picture this. You've got a toothache, you walk into an apothecary and the pharmacist says, "Here, try a teaspoon of pulverized farro." And you do it. Will it fix your pain? No. Will you regret eating a 2,000-year-old corpse sprinkled on your porridge? Absolutely. This wasn't a fringe thing either. Mummy powder was so popular that Europeans basically looted Egyptian tombs to keep up with demand. Entire mummies were stolen, ground into dust, and shipped across the continent as miracle medicine. Even royalty and nobles were in on it, popping mummy pills like ancient Advil. Of course, instead of curing anything, it mostly just gave you a bad case of 8-dead-person-itis. So there you have it. Drills in your skull, smoke in your butt, and a side of powdered mummy for dessert. Ancient medicine wasn't healing. It was just creative torture with a medical excuse. Anyway, that's how civilization invented hospitals and lifelong trauma. Subscribe before someone brings back the smoke enema.